These are like 17,000 pesos, 850 euros. And these? How much? Like 20,000 pesos.
In Grecia's dressing room, shoes and luxury clothes are everywhere. The 28-year-old woman and her friend Leslie spend all their money and their time on their appearance.
160,000 the last lipo. Breasts, 80. Men here are used to dating vain, voluptuous women. And if you don't have an ass or you're flat, you know how they are. You know how they are. Oh, that one doesn't have an ass. Here they're like that. It's the culture.
Here in Culiacan, many women like Grecia resort to plastic surgery to shape their bodies. Most of them aspire to look like the figure of the buchona, a voluptuous woman who is linked to the narco culture. This is a character created here in the capital of the Sinaloa cartel.
Many of these women have relationships with narcos, people who are dedicated to drug trafficking. And they are the ones who finance or pay for the surgeries. But it's also a goal to be like a buchona and to live in this environment or even be part of this world. To follow the fashion without being a drug trafficker or having a boyfriend or someone who pays for these surgeries. To be able to pay for them yourself and just look like these women.
Cosmetic surgery clinics are well established in the city's main streets. On social media, ads boast about spectacular results at low prices. But most doctors operating behind these profits are not qualified in plastic surgery. Some even mutilate patients, who then end up on Rafaela Martinez Terraza's operating table.
She has a torn muscle in her chest, and she wants to reconstruct it because it hurts during certain activities. The implant moves and it bothers her. It's common to have to reconstruct patients after mutilated surgeries that have gone wrong due to poor practice.
It's a tough problem to control.
In 2017, there was one qualified plastic surgeon for every 20 pseudo-surgeons.
Cristina is in the operating room today. The 48-year-old woman had breast implants inserted a year and a half ago by an unqualified doctor. Shortly after the operation, she immediately felt an abdominal pain.
A few days after the surgery, my breast started to swell up. I felt like it was going to explode. I was in a lot of pain and I had to go back to have another surgery. The doctor charged me again. I told him I couldn't bear the pain. He told me that all I had to do was drink tea and put on a morphine patch.
The healthcare watchdog, Copris, is tracking down these clandestine clinics. Since January 2022, in Sinaloa, out of 168 inspected establishments, 28 have been closed, like the one in these images.
You can see a very simple bed, and you can also see a window, and that shouldn't exist. There shouldn't be a window because it could contaminate the air.
But the lack of action against so-called doctors means these establishments remain open. You identify these bad practitioners, yet they continue to practice.
They continue to practice, that's correct.
Without appropriate criminal prosecution, fake surgeons have been causing havoc for a long time. 18 years ago, Leticia was invited by a friend to undergo an injection of what was thought to be hyaluronic acid in the buttocks.
5 years after the surgery, my skin started to darken. And then it became very thin. Once I fell backwards and I was bleeding so much, it wouldn't stop. It's a tragedy. Your whole life will never be the same again. Your life will never be the same. Save what you can of your life, because sometimes you can't.
Since January 2022, 3 people in Sinaloa have died as a result of botched plastic surgery. Here in Mexico, a bill has been presented to Parliament that aims to create a specific offence of providing plastic surgery while unqualified. punishable by 6 to 10 years in prison.